Hi, everybody. I'm Rich Huddleston, Executive Director for Arkansas Advocates for Children and Families. And I'm here today to talk about an emerging crisis in healthcare coverage for Arkansas children. As we all know, healthcare coverage is critical for the healthy development of children. When children get the healthcare they need, they're more likely to be healthy, succeed in school, earn higher wages, and be healthy and productive adults. So it's good not only for the health of kids today, but it's good for our future workforce and our future state economy too. But the Georgetown Center for Children and Families recently released a new report on the state of children's healthcare coverage across the states. And data in the report shows Arkansas is part of a nationwide trend of declining healthcare coverage for kids that took place during a period of economic growth from 2016 to 2019, a time when the uninsured rate should have been declining because of the good economy. The increase in uninsured children in Arkansas is particularly alarming. Based on 2019 data, there are approximately 43,000 uninsured children in Arkansas, up from 30,000 in 2016. That's 13,000 more uninsured children in Arkansas, a 43% increase, and one of the largest increases in the country in percentage terms. Our uninsured rate is now almost 6%, up from our historic low of just 4% in 2016. And the report also found that many uninsured children are eligible for Medicaid or CHIP but are not enrolled. And it's important to note that this data was collected prior to the COVID-19 pandemic. And although we don't have good data yet on healthcare coverage during the pandemic, most experts believe that the number of uninsured children in Arkansas and nationwide is likely to be much higher in 2020 as more families have lost jobs as a result of the economic recession and have lost access to employer-sponsored insurance plans. And this new trend, unfortunately, occurs after Arkansas had previously seen a long-term positive trend of successfully reducing our child uninsured rate. If not reversed, this new damaging trend will have long-term consequences for children and for communities across Arkansas, because without healthcare coverage, children cannot access the care they need to grow and thrive. The Georgetown report found a number of factors that might have contributed to increases in uninsured rates nationwide. These include: one, large cuts in outreach and enrollment assistance and other efforts that have undermined the ACA at the national level and in the states. Two, the creation of a climate of fear and confusion for immigrant families that discourages them from enrolling their eligible children in public programs like Medicaid and Our Kids First. Three, red tape barriers that make it harder for families to enroll or stay enrolled in Medicaid and CHIP. And in Arkansas, the implementation of work reporting requirements for Arkansas's Medicaid expansion for low-income adults in 2018 and 2019 probably also had an impact on access to healthcare coverage for kids. So while the courts eventually ruled against those work reporting requirements for adults in the Medicaid expansion and put them on hold in March of 2019, they likely heard coverage for kids too during that time. How can that be, you ask? Well, anytime you have additional red tape that causes parents to lose their coverage for programs like Medicaid, it becomes more likely that parents are going to fail to maintain coverage for their kids as well, because in many cases, they may just assume that their kids are no longer eligible for coverage. At Arkansas Advocates, we offer the following recommendations to reverse the recent trends in healthcare coverage for children. One, let's adopt continuous eligibility for Our Kids A. 1 year continuous eligibility would ensure that a child's coverage is not terminated within a single year because of fluctuations in family income that are common for low-income families because of the types of jobs they work in. Arkansas already has this policy in place for children and families with slightly higher incomes enrolled in Our Kids B, but we don't yet have it for Our Kids A, and we need to do that. Three, we need to adopt presumptive eligibility for Medicaid for children and pregnant women. Presumptive eligibility would allow Arkansas to temporarily enroll people in Medicaid while waiting for their full applications to be processed. Presumptive eligibility on a provisional application allows children and pregnant women to begin receiving services immediately without having to wait for the full Medicaid application to be processed. Four, We need to increase our Kids First outreach and enrollment for all kids, but especially for kids in immigrant families when immigrant kids are eligible for our Kids First now but are not enrolled. We also need to provide 1 year postpartum Medicaid coverage for a mother and baby instead of the current 60 days. And finally, for once and for all, let's forget about work requirements for adults in our Medicaid expansion. They don't work for adults and parents, and they hurt coverage for kids too. So that's it. These are the steps that we can take to stop this damaging trend of Arkansas kids losing their health care coverage. But we must act now. Let's tell our policymakers that we need to do better in terms of providing health care coverage for kids. We cannot continue to go by another year with more kids losing their health care coverage, because even one child without access to health care coverage is one child too many. So thanks and have a good day.